इंदिरा देवी नाम है, दुर्गापुर से आया हूँ। पहले बहुत खांसी था, बहुत तबीयत खराब था मेरा, बहुत बढ़िया इलाज किया है, बहुत ठीक किया है, बहुत इधर का अच्छा है। डॉक्टर भी बहुत अच्छा हो रहा है इधर, तभी नर्स भी बहुत अच्छा है, इलाज भी बहुत अच्छा करता है। सांस में तकलीफ था, सांस नहीं ले हो रहा था मेरा, अभी हो रहा है मेरा। तो सर है नहीं, पर्सन सर है नहीं इधर, ये बोला है इधर बहुत अच्छा है हॉस्पिटल जा, यह भेजा है हमको। हाँ, विश्वास सर जी हमको बहुत अच्छा किया, बहुत बढ़िया क्या विश्वास सर, अब बहुत अच्छा है। हम हॉस्पिटल बहुत अच्छा है, नर्स भी बहुत अच्छा है, डॉक्टर और सब अच्छा है। इधर से आया था, बहुत का हालत ख़राब था मेरा, अभी बहुत अच्छा है।
Hello friends, I am Dr. Vishweshwaran, currently working as a consultant interventional pulmonology and sleep medicine specialist at Yashoda Hospital, Somajiguda in Hyderabad. Our patient Mrs. Indra Devi was referred to us from Durgapur in West Bengal for a complaint for a condition referred to as a tracheal stenosis. This tracheal stenosis is nothing but the narrowing of the windpipe through which a patient normally breathes, and in her condition the tracheal stenosis was so severe that almost there was a 90% obstruction of the lower end of the windpipe, and because of that she was not able to breathe despite being at rest. She was not able to do even her day-to-day routine activities like taking bath or household chores. So for this complaint she was referred all the way from Durgapur, and when the patient presented to us and when we examined the patient was critically ill. The patient was having stridor, which is a sign which says that the patient is going in for a respiratory arrest, and along with that the patient was having severe increase in her heart rate, breathing rate, as well as her oxygen levels were going down. At this point we explained to the attender that the patient requires an emergency surgery, which we refer to as a rigid bronchoscopy and tracheal stenosis dilation with the help of a cryotherapy. So we took the patient in operation theatre, and when we examined with the help of a bronchoscope, we were able to see that more than 90% of the lumen was obstructed, and it was deemed as an extremely high risk surgery. And then we took this patient in the surgery and we did the rigid bronchoscopy. We also dilated this tracheal stenosis, and whatever granulation tissue that was there was removed. And following the procedure, the patient was removed from the ventilator the next day, and after that the patient had a very significant relief in the breathlessness. Now the patient is getting discharged, walking. She says that she has got relieved of her breathlessness and she is able to do her day-to-day activities. We are planning for an interval stenting as well. That will be taken up when the patient remains stable. Thank you.